Respiratory therapists are highly trained medical professionals who care for patients with breathing problems. They work in hospitals, clinics, and other healthcare settings and often collaborate with other members of the healthcare team to provide the best possible care for their patients. The respiratory therapy curriculum is designed to prepare students for the challenges of this rewarding and demanding career. But what exactly do they learn in respiratory therapy school? Well, in this video, we will discuss the inner workings of a respiratory therapy program and what students can expect to learn while in school. So, if you're ready, let's get into it. As previously mentioned, respiratory therapists provide care for patients with a variety of breathing disorders such as asthma, COPD, and cystic fibrosis. They are also responsible for providing life support, including managing and setting up patients on a mechanical ventilator. Respiratory therapists are required to perform a variety of high-level duties while on the job. Therefore, RT programs must prepare students for the challenges they will face throughout their careers. Here are some of the things students can expect to learn while in school. First is the history of respiratory care. Respiratory therapy is a relatively new discipline in the medical field, but its therapeutic practices date back throughout history. Therefore, to become a respiratory therapist, students must first learn about the history of this profession and where it all began. Next up is patient safety. Patient safety is of the utmost importance in any healthcare setting. In respiratory therapy school, students will learn how to keep their patients safe while providing care. This includes learning how to properly handle and use medical equipment, as well as ambulation and safe patient transport techniques. Students will also learn about infection control and prevention. Infection control is a critical component of respiratory care. Students will learn how to identify and prevent infections in both themselves and their patients. This includes learning about standard precautions, as well as how to clean and disinfect medical equipment properly. Next up is medical terminology. Since respiratory therapists work in a medical setting, they must be able to understand and speak the language used by other medical professionals. This means that students must learn how to use and understand the basic and advanced medical terms and abbreviations. The next one is complex, but students must learn anatomy and physiology of the respiratory system. A thorough understanding of the respiratory system is a requirement for all respiratory therapists and students. Therefore, students will learn about the structure and function of the lungs, airways, and other respiratory structures. And they must also learn about the cardiovascular system as well. The cardiovascular system works closely with the respiratory system, and therefore, RTs must have a basic understanding of how it works. This means that students must learn about the structure and function of the heart, blood vessels, and other cardiovascular structures. Next up is airway pharmacology. Respiratory therapists use a variety of medications to treat patients with respiratory disorders. Therefore, students must learn about the different types of drugs used in respiratory care. This includes learning about the indications, contraindications, and side effects of these medications. Another important topic is neonatal and pediatric care. Respiratory therapists are most often recognized for treating adult patients with breathing problems. However, they also provide care for neonatal and pediatric patients as well. This means that respiratory therapy students must also learn how to assess and treat breathing problems in infants and children. And one of the most important topics that students must learn in school is mechanical ventilation. Mechanical ventilation is an intervention used to treat patients who are unable to breathe on their own. It's a form of life support that uses a machine to force air into the lungs. Respiratory therapists are responsible for managing and setting up patients on ventilators. Therefore, students must learn how to properly use these life-saving devices. The next topic that I should mention is the physical principles of respiratory care. This is a topic that is essential for all respiratory therapists. This includes learning about gas laws, pressure-volume relationships, and ventilation to perfusion ratios. Learning this information is not an easy task, but it is an important and fundamental step in becoming a respiratory therapist. Another very important topic that students will learn about is arterial blood gases, or ABG. This is a test that measures the oxygen and carbon dioxide levels in the blood. It involves using a syringe to collect a blood sample from a patient's artery. Respiratory therapists are responsible for collecting the sample and analyzing the results. This means that students will learn the process of sticking an artery while in school. The next topic is also important, and it is intubation. Intubation is a medical procedure that involves inserting a tube into the trachea to help a patient breathe. This establishes a link between the patient and the mechanical ventilator. Respiratory therapists are one of the few medical professionals who are licensed and trained to perform this procedure. Therefore, students must learn the entire intubation process while in school. The next subject matter is patient assessment. To provide the best care possible for their patients, RTs must perform a comprehensive assessment. This includes taking a patient's medical history, conducting a physical exam, and ordering diagnostic tests. After the assessment is complete, the respiratory therapist will help develop a plan of care for the patient. This is something that students will learn how to do while in school. And this includes checking a patient's vital signs. Vital signs are measurements used to assess the body's most basic functions. This includes temperature, pulse, respiratory rate, and blood pressure. All healthcare professionals, including RTs, must be able to properly measure and interpret a patient's vital signs. This is a quick way to assess their condition. You must also learn a patient's normal values. To properly assess a patient, respiratory therapists must know what the normal values are for various measurements. For example, they need to know the average blood pressure, heart rate, and oxygen saturation level. This information is essential for all respiratory therapists as it helps them quickly identify when a patient is outside of the normal range. Speaking of oxygen saturation, it is a measurement of the amount of oxygen that is being transported in the blood. This can be measured using a pulse oximeter, which is a device that attaches to a patient's finger for quick and accurate readings. Respiratory therapists must understand how to properly use a pulse oximeter and interpret the results, as this is a task that they will constantly perform while on the job. Another important skill is CPR, or Cardiopulmonary Resuscitation. This is a life-saving technique used to revive patients who are not breathing or have no pulse. This involves delivering chest compressions and rescue breaths at the appropriate time. Respiratory therapists and students are required to keep their CPR certification up to date. Therefore, they must learn and fully understand this procedure. Auscultation is another essential skill. It is the process of using a stethoscope to listen to the internal sounds of the body. This is performed by respiratory therapists on every patient as they are responsible for listening to the sounds in the lungs. When abnormal breath sounds are heard, it can indicate that a respiratory issue is present. Respiratory therapy students will learn how to use a stethoscope and identify different types of breath sounds while in school. Next up is pulmonary function testing. This is a set of non-invasive tests used to assess the lungs and respiratory system. Respiratory therapists are responsible for administering these tests and interpreting the results. PFTs are important in diagnosing and managing various respiratory conditions. Therefore, students must learn about the different types and equipment. Earlier, I mentioned mechanical ventilation, but RTs must also learn about non-invasive ventilation, which is a type of ventilatory support that can be delivered without the insertion of an artificial airway. The two most common types are BiPAP and CPAP. Respiratory therapists are responsible for setting up and managing patients on these machines. Therefore, they must be well versed in the different types. Next up is oxygen therapy, which involves the administration of supplemental oxygen to a patient. This is often indicated when a patient has hypoxemia, or in other words, low oxygen saturation levels. There are several different types of oxygen delivery devices which must be understood by respiratory therapists and students. One of the most common job duties of respiratory therapists is giving breathing treatments. Breathing treatments are administered to deliver an aerosol medication to the patient's lungs. It involves the use of a nebulizer, which is a device that converts liquid medication into a fine mist. Again, this is one of the most common treatment modalities provided by respiratory therapists. Therefore, students will learn how to properly administer these treatments during clinical rotations. Next up is chest physical therapy, or CPT. It's a therapeutic modality used to help clear secretions, improve ventilation, and strengthen breathing muscles. It involves different techniques such as postural drainage, percussion, and vibration. Respiratory therapists must be well versed in all aspects of CPT in order to properly treat their patients. Students will often perform these techniques during clinical rotations. Students will also learn how to perform airway suctioning, which is a procedure that is performed to remove mucus and secretions from a patient's airway. This is a common task performed by respiratory therapists on a daily basis. Many are grossed out by the thought of suctioning mucus. However, it is an important and necessary part of the job. So if you can't handle it, respiratory therapy is probably not the best career choice for you. Moving right along, RTs must learn about several breathing disorders, and the first type is obstructive lung diseases. These are a group of conditions that constrict the airways, which makes it difficult to breathe. Some examples include asthma and COPD, which affect millions of people around the world. Respiratory therapists must be well versed in different types of obstructive lung diseases and how to properly treat these conditions. They must also know about restrictive lung diseases, which are a group of conditions that limit the expansion of the lungs. This results in less air being inhaled, which causes issues in the respiratory system. Some examples of restrictive lung diseases include interstitial lung disease and pulmonary fibrosis. Respiratory therapists must also be familiar with these conditions. The next topic I want to mention is smoking cessation, which is another important aspect of respiratory care. That is because smoking is one of the leading causes of preventable death, and many respiratory conditions are caused or exacerbated by smoking. As such, respiratory therapists must understand the importance of quitting smoking and be able to provide education and counseling to their patients. Similarly, RTs are also involved in asthma education. Asthma is an obstructive lung disease that affects millions of people worldwide. It is a chronic condition that can be managed but not cured. Therefore, respiratory therapists are highly involved in the treatment of patients with asthma. This includes educating patients and their families about how to manage the condition and what to do in the case of an asthma attack. They are also involved in COPD management. COPD is a progressive lung disease that is caused by long-term exposure to irritants such as cigarette smoke. Respiratory therapists care for patients with COPD by helping them manage their symptoms and improve their quality of life. In respiratory therapy school, students learn about the different types of COPD, how to assess patients for the severity of their disease, and how to develop a treatment plan that includes both medication and lifestyle changes. The next topic is lung cancer, which is a major public health problem in the United States that causes approximately 25% of all cancer deaths. It can develop in non-smokers, however, most cases occur in those who smoke. Respiratory therapists play an important role in the treatment of lung cancer patients. Therefore, students must learn about this disease while in respiratory therapy school. And they will also learn about the different types of lung infections. There are several types that affect the respiratory system and can impact a patient's ability to breathe. As such, respiratory therapists must be familiar with these conditions and know how to treat them. Another class of respiratory disorder includes the different types of pleural diseases. These are conditions that affect the pleura, which is a thin membrane that surrounds the lungs. These conditions can be caused by infection, inflammation, or trauma. The two types are pleural effusion and pneumothorax. Respiratory therapists must know how to recognize, diagnose, and treat these conditions. Now, hopefully this video isn't putting you to sleep yet, because respiratory therapists are also involved in the treatment of patients with sleep disorders. These are conditions that affect the quality, duration, timing, or impact of a patient's ability to sleep or function properly while awake. Some examples include sleep apnea, insomnia, and restless leg syndrome. Respiratory therapists must have a basic understanding of sleep physiology and how to treat these disorders. And one of the most common diseases that RTs treat is pneumonia, which is a lung infection caused by bacteria, viruses, or fungi. It's a serious condition that can lead to death, especially in elderly patients or those with underlying health conditions. Respiratory therapists must know how to recognize the symptoms of pneumonia and how to treat it. They also need to be familiar with the different types of pneumonia, as each type requires a different treatment approach. Next up is congestive heart failure, or CHF. It's a condition in which the heart cannot pump enough blood to meet the body's needs. This can lead to fluid buildup in the lungs and other organs. The accumulation of fluid in the lungs is known as pulmonary edema. Respiratory therapists must know how to recognize and treat this condition. The next topic is carbon monoxide poisoning. Carbon monoxide is a colorless, odorless gas that is produced when certain fuels are burned. Carbon monoxide poisoning can occur when people are exposed to high levels of this gas. This is a very serious condition that can lead to death without prompt treatment. Therefore, respiratory therapists must know how to recognize the symptoms and treat patients with this condition. Neuromuscular diseases are conditions that affect the nerves and muscles. These conditions can lead to difficulty breathing because of muscle weakness and paralysis. That is why respiratory therapists must be familiar with these conditions, and some examples include Guillain-Barré syndrome and myasthenia gravis. Respiratory therapists must also learn about thoracic imaging. This refers to the radiographic imaging of the thorax, which includes the chest and lungs. Some examples include a chest radiograph, CT scan, VQ scan, or a PET scan. Respiratory therapists are required to have a basic understanding of each type. Therefore, this is something that students must learn while in school. Respiratory therapists are skilled professionals in assessing and interpreting a patient's breathing patterns. This includes identifying the different types, such as eupnea, hyperpnea, apnea, and apneustic breathing. This helps with the diagnosis and treatment of a patient's underlying condition. Therefore, students must learn how to identify different breathing patterns to be successful as respiratory therapists. I've talked mostly about adult patients in this video, but RTs are also sometimes called upon to assist in the delivery of newborns. This includes performing resuscitation if necessary and ensuring that the infant is breathing properly. This topic is covered in detail in the neonatal courses of the respiratory therapy program. So if you're interested in working with infants, this is something to look forward to while in school. The next topic is electrocardiograms, which is a test that measures the electrical activity of the heart. It is often used to diagnose heart conditions or to monitor the heart's response to treatment. Respiratory therapists are often called upon to perform this test. This includes knowing how and where to place the electrodes on a patient's skin. This is a skill that students must learn while in school. This often involves practicing on mannequins or even on your other classmates. Next up is fetal lung development, which is the process by which the lungs develop during pregnancy. This is a crucial process as the lungs must be fully developed for the baby to survive outside of the womb. Respiratory therapists must have a thorough understanding of this process. That is because they may be called upon to provide care for mothers and babies with lung conditions. Also, there are several infant respiratory disorders that RTs must be familiar with. Some examples include neonatal respiratory distress syndrome, meconium aspiration syndrome, and apnea of prematurity. Respiratory therapists are required to have a high level of knowledge on how to treat and provide care for infants born with these conditions. Switching gears again, another important topic is the ability to wean patients from the mechanical ventilator. Ventilator weaning is the process of gradually decreasing a patient's dependence on the machine. This is done when the patient's condition has improved and they can breathe on their own. Respiratory therapists play a vital role in this process. They assess the patient's progress and make recommendations to the physician on when to remove the patient from mechanical ventilation. Next up is lung expansion therapy. This refers to several respiratory care procedures that are designed to treat and prevent atelectasis, which is a condition in which the tiny air sacs in the lungs collapse. Respiratory therapists are trained in performing these procedures to help keep the patient's lungs inflated while preventing alveolar collapse. Another important type of treatment is humidification therapy. This involves adding water vapor to an inspired gas to treat pulmonary diseases. This type of therapy is commonly used to help loosen up thick mucus and secretions from the patient's airways. Respiratory therapists are experts at administering this type of treatment, and this is yet another skill that students are required to learn while in school. RTs also assist with the bronchoscopy procedure, which is when a flexible tube is inserted into the lungs. It contains a camera and light source, which allows the physician to visualize inside of the patient's airways. Respiratory therapists are needed to assist with this procedure, which involves preparing the patient and equipment, as well as monitoring the patient during and after the procedure. Another type of monitoring that RTs are involved in is hemodynamic monitoring. This is a process of measuring various parameters related to blood flow and pressure. In other words, this provides a measurement of the pressure inside a patient's heart and blood vessels. Respiratory therapists must be familiar with the different types and parameters, and students are required to learn about this topic in school. Another critical type of treatment is extracorporeal life support. This is an advanced form of therapy where blood is pumped outside the body for oxygenation and then returned to circulation. This is indicated in severe cases where the patient's heart and lungs are inadequate. Next up is Cardiopulmonary Rehabilitation, which is a program designed to improve the health and well-being of a patient with a condition of the heart or lungs. The primary goal is to help participants return to their normal activities of daily living as soon as possible. Respiratory therapists are typically involved in designing and administering these programs. They work with other members of the rehabilitation team to help patients reach their goals. RTs are also responsible for airway management, which is an important process in maintaining ventilation so that gas exchange can occur. This allows a patient to take in oxygen while removing carbon dioxide. Respiratory therapists must keep the patient's airways free and clear of foreign substances so that air can flow into and out of the lungs. The different types of airway management include suctioning, airway maintenance, establishing an artificial airway, and extubation. Speaking of airway management, respiratory therapists are also responsible for tracheostomy care. A tracheostomy is a surgical procedure in which an opening is made in the neck so that a tube can be inserted into the trachea. This is indicated when a patient is expected to be on the mechanical ventilator for an extended period of time. Respiratory therapists are responsible for the care of the tracheostomy, which includes cleaning the site, changing the tube, and suctioning the patient. Another very important topic is gas exchange. Gas exchange is the physiological process of diffusion where oxygen moves from the lungs to the bloodstream during inhalation and carbon dioxide moves from the blood to the lungs for removal during exhalation. This is a fundamental topic that must be understood by anyone working in the field of respiratory care. The next topic is acute respiratory distress syndrome, or ARDS. This is a condition that occurs when the lungs are severely damaged and cannot provide enough oxygen to the body. It results in several oxygenation issues that can lead to respiratory failure. RTs must recognize the signs and symptoms of ARDS and be able to recommend the appropriate treatment modality. Respiratory therapy students will learn the ins and outs of this condition while in school. Earlier, I mentioned oxygen therapy, which is a type of medical gas therapy. This is a type of treatment in which gases are administered to a patient. Each type of medical gas, including oxygen, is considered to be a drug. This means that it must be administered with the approval of a qualified physician or respiratory therapist. When administering medical gas therapy, RTs must consider the type of gas, dosage, and delivery method. Each may vary depending on a patient's condition. Next up is airway clearance therapy, which is a type of treatment that helps remove secretions from the airways of the lungs. This helps improve gas exchange so that the patient is able to take in oxygen while removing carbon dioxide. The different types of airway clearance therapy include CPT, PEP therapy, autogenic drainage, high-frequency chest wall compression, intrapulmonary percussive ventilation, and mechanical insufflation-exsufflation. Respiratory therapists must be able to assess the patient's needs and recommend the appropriate type of airway clearance therapy. This is an important topic that students will learn in school as well. And believe it or not, respiratory therapists must also learn a few important formulas and calculations. But before you freak out, just know that you do not need to be a mathematician to become a respiratory therapist. However, some basic arithmetic skills are necessary, including the ability to plug numbers into a formula and perform simple calculations. Some examples include calculating minute ventilation, temperature conversions, and determining a patient's ideal body weight. And another very important skill that RTs learn is extubation. This is the process of removing an artificial airway from the patient's trachea to discontinue mechanical ventilation. This is done when the patient's condition has improved and they no longer need ventilatory support. Respiratory therapists play a vital role in this process by assessing the patient's progress and making recommendations to the physician on when the patient is ready to be removed from the ventilator. And finally, students must learn how to prepare for the board exams. In order to become a licensed respiratory therapist, students must pass 2 separate board exams offered by the NBRC. This includes the TMC exam and clinical SIMS. Both exams are extremely challenging and students must be well prepared in order to earn a passing score. Most RT schools offer review courses to help students prepare. However, the responsibility ultimately falls on the student to ensure that they are fully prepared. With that said, we're proud to say that our exam prep materials have helped thousands of students pass both exams on their very first attempt. So check out the links below if you want to learn more. But as you can see, respiratory therapy school covers a wide range of topics, from diseases and conditions of the respiratory system to pharmacology and treatment modalities. RT students will receive a comprehensive education. It's definitely not easy, but it is necessary for becoming a successful respiratory therapist. With the right attitude and determination, anyone can succeed in this field. So my question is, are you up for the challenge? If so, then respiratory therapy school might just be the right fit for you. If you want to learn more, visit our website at respiratorytherapyzone.com. And if you want to support the channel, be sure to like and subscribe. I would greatly appreciate it. And there should be some other helpful videos popping up on your screen right about now that I think you will enjoy. And just a quick reminder, we are not doctors. This video is for informational purposes only. Thank you so much for watching. Have a blessed day. And as always, breathe easy, my friend.